Welcome back, everybody. It's Ask the Expert with Robillard Hearing Center. JB Robillard is here, and so is our telephone number, 613-789-6559, extension 2803. Ottawa.morning@ctv.ca is our email address. You can also ask us a question on Facebook or Twitter, and we've got some questions coming up in just a couple minutes. First, I wanted to explore the technology a little bit. What you and I were talking about in the break. You know, the ear is such a unique thing. It's so individualistic. Mm-hmm. It's not like a lot of people will look at laser eye surgery, and it's an instant remedy for an existing problem. Yeah. But that's not always the case when there are hearing issues.
No, typically, and you're right about how individualistic a hearing loss is. It's like it can almost be described as a snowflake, if you will. Okay. So it tends to vary from frequency to frequency. Although we'll see the common pattern, the typical pattern, but there are still variations enough that are significant. So it varies greatly from individual to individual.
And the toughest part about the technology, although it's advanced so much in the last few years, is that narrowing it down, right, to how it would work with each and every individual is such a difficult thing to do.
Well, our testing procedures have advanced considerably as well, so we can become very, very specific. So we can provide the exact amplification that you need according to your hearing loss. Yeah. But the main adjustment to our patients is ultimately hearing aids. It's an artificial way of hearing. It's a whole new auditory system that you have to learn. Your brain has to adapt to. And another major challenge as well is learning to hear normally. I mean, the new technologies that we have are very aggressive, and we can get you hearing very close to a normal level, if not completely. But now the challenge becomes learning to reintegrate all those sounds that have dissipated over the years. Yeah. That takes some time.
That's a big adjustment too,
It certainly is, it certainly is.
All right, let's get to our first caller of the day. Beverly is on the telephone. Good morning, Beverly. How are you?
Oh, I'm fine, thank you.
Very good. What's your question today?
Okay, I'm a hearing aid patient. I have a hearing aid, and I'm also a client of the Robillard Hearing Center on MacArthur Avenue.
Oh, very good.
And I was wondering if those small little hearing aids, because I have a hook now.
Mm-hmm. Okay.
And I was wondering if those small little insert hearing aids that you're showing on TV this morning were good for people who had chronic hearing loss, like where on an ear hearing graft you would be like more or less the bottom line.
Yeah. Okay. So more like a severe hearing loss, I guess, right? Yeah, well, in fact, there's been some improvement to that circuitry very recently, and so we can now treat a severe hearing loss. Not a profound hearing loss, but certainly severe. That's very feasible. Okay. So the best thing to do is to speak to your clinician to see if that instrument is suitable for you.
And Beverly's a client of yours,
That's right. That's right. Yeah.
So and people who have been clients of yours over a long time, and there are many of them, I'm sure, who have technology that's not so recent, should always consider, coming in to be reevaluated and maybe fitted for something different.
Yeah, I mean, what can happen over time is your hearing ability may change. So what we typically recommend is another hearing evaluation every, say, 3 to 4 years. Right. And of course, if the individual does sense that their hearing has changed, then we recommend them calling us immediately and getting it evaluated. But unfortunately, hearing aids have a certain lifespan. Yeah. You know, it's a digital instrument, and so the circuitry generally will only last, depending on the maintenance of the hearing aid, but generally 3 to 5 years is about the norm. 4 being the average, I guess. Yeah. And so unfortunately, they do have to be replaced over time.
And people with hearing loss and have been affected by that over at any point in their life might be reading up on the latest technology and maybe just want to try it and see if it works for them, and that's always worth doing.
Absolutely, absolutely. I mean, there's ongoing improvements. Of course, they're digital instruments, and we all know digital technologies are continually improving. And so the benefit with the new technologies is they're more aggressive in offering improvement to your hearing. I mean, we can address your hearing loss more aggressively, help you hear better, essentially. Yeah. And we offer a trial period as well on all our instruments, so that allows our patients to try the instruments out and see if it's worth their investment.
Right, to see if they can adjust to this particular device, to see if it works for them the way they want it to, right?
Exactly.
Is there any tinkering that goes on, JB, with these instruments themselves? Like, you can set them at different levels and adjust to different situations?
Well, usually we do that over the fitting period.
Right.
So generally you'll have several adjustments that are necessary. So for example, the first fit would be somewhat generic. I mean, it would be based on the individual's hearing loss and their experience with hearing aids and just their general reaction, their first impression, if you will.
Yeah.
And over time, as they follow up with their clinician, then we would make the necessary adjustments. These instruments do a lot of data logging as well, which is really interesting.
Oh, is that right?
That's right. So we can really customize the programming of the hearing aid just based on the individual's lifestyle. So typically the hearing aids that we carry just track the type of environments that the patient frequents. And so we can design the adaptability, the response to the hearing aid based on the patient's lifestyle.
No kidding. Mm-hmm. That's something that wasn't around when Robillard Hearing Centers first came to be.
No, probably not.
No, not at all. All right, we'll take another break, but still an opportunity for you to get in with your questions here this morning. 613-789-6559, extension 2803. Ottawa.morning@ctv.ca is the email address. You can Facebook a question, tweet a question, what have you. One more segment to go. So get those questions in about hearing-related issues that you or someone you know may have. This is Ask the Expert with Robillard Hearing Centers. We'll be back after this.